and probably one of the most important responsible pleasures is work. Some individuals might find this to be an unusual choice for pleasure, since many think of work as drudgery or toil. As an occupational physician, however, I have found that those who are fortunate enough to achieve gratifying and meaningful work are probably experiencing a major health and longevity benefit. One of the manifestations of achieving meaningful and health-enhancing work is the capacity to achieve the highly efficient state of what is known as flow, a state defined by creativity expert Mikhail Csikszentmihalyi. Flow is a neurobiological state where skills and capacities are optimally matched to challenges during a given task or endeavor. Peak performers in the arts, the military, and athletics know this state well. Flow is also characterized by deep concentration and focus, a subjective sense of timelessness, and a lack of awareness of external surroundings and extraneous environmental stimuli. Yet, flow is a highly creative state and is associated with extraordinary, some say almost effortless, voluminous work output. This concept needs to be expanded from applying only to peak performers to being applicable to a broader array of our working population, at least for a part of their working day. You already know that the opposite is true. That is, that acute and chronic work stresses can negatively impact our health. Robert Karasak of the University of Massachusetts has characterized the now well-known demand control work model, where he and many others have demonstrated through rigorous research that workers who have high demand positions, yet low control, such as garment workers, waitresses and waiters, bus drivers, nurses' aides, telephone operators, and freight workers, where decision latitude is small or non-existent, are especially vulnerable to the adverse consequences of work stress and resultant negative psychological, social, and medical outcomes. Health problems associated with this are especially documented in heart disease and musculoskeletal diseases, such as low back pain and cumulative trauma disorders, such as carpal tunnel syndrome. One classic American Psychological Association study that examines social factors in predicting life expectancy found that work satisfaction had the highest correlation with longevity. Based on my 25 years of experience in occupational medical practice, I am convinced that those individuals who have achieved job satisfaction and who have found meaningful activities in their daily working lives throughout their careers and into retirement fare significantly better from a health perspective than those who view work as mindless drudgery to be endured only as a means to an income, and who view retirement as a release from the prison of work. Thus, in summary, the real revolution in medicine is not more reductionism, as per the overly optimistic promises of more molecular biology or the Human Genome Project, to give you two examples. While these extraordinarily technical advances will continue to make a contribution, they are not medicine's real contemporary revolution. Nor, for that matter, is alternative medicine in its classic form unless it more fully embraces the issues I have referred to today. The real revolution in medicine is a neuroscience-driven biopsychosocial model, which we have been discussing today, one that integrates work, health, and the environment. As noted earlier, Internet technology is driving patient knowledge and empowerment to unprecedented heights, and the U.S. is finally coming to grips with such issues as death and dying and its neurotic hang-up with responsible pleasures. Thus, medicine continues to experience the throes of an extraordinarily painful but necessary transition. But I believe that new, more mature, healthy, contemporary models or paradigms in health and medicine are emerging as we speak. I further believe there is a moral imperative to be optimistic, thus providing hope for future generations. Thank you.
Thank you, Dr. Lippin. Let us continue now with the second question and answer session. And our first question comes to us from the Centro Universitario de Tijuana, and we look forward to your question.
Sí, buenos días.
Good morning. Why haven't there been any health plans designed to prevent and or diminish stress, and that these don't, how come they don't contemplate the controlled use of drugs?
Health plans, controlled use of medications to help manage the health of a working population. From the health plan side, Kathlyn, very quickly.
I think clearly that health plans have to consider stress management associated with drug use, etc., as a component of the larger healthcare continuum. It's not an individual component, it's a larger piece of the component.
How about from the clinical side, Dr. Lippin?
Well, there's no question, as you heard during my presentation, that stress plays a major role in health outcomes. And I think innovative health plans are beginning to deal with the stress issue. Certainly, health maintenance organizations are very much beginning to cover those issues. Corporations are offering stress management programs. So I think we're beginning to deal with this and beginning to understand the huge impact of stress in our lives.
Yes or no, can medications assist in achieving responsible pleasures?
There is no question that the miracles of modern pharmacology, medicine, can play a role. It's not either or, it's both.
Okay.
So we have enormous respect for the miracles of what we call psychotropic medications, anti-anxiety medications, antidepressant medications save lives every single day. But there is not a pill to cure every winter of discontent.
There we go.
We need to do both.
Very good. Thank you both very much. Great question. The next question comes from the Secretaría de Educación Pública in Sinaloa, and we look forward to your question.
Buenos días, buenos días.
What methodology would you suggest for us to operate health programs amongst fathers, parents, who belong to lower socioeconomic levels and where alcohol and tobacco are very highly used?
Okay. Dr. Lippin, you spoke of socioeconomic status in your talk as well as a couple of answers. How would you address this?
Yes, a good question, and I would imagine that many of those individuals on a lower socioeconomic level, first of all, don't even have the basic security of employment. So we need to have income for these people. We need to have jobs, and I'll start out with that. And of course, corporations for many years in the United States and now beginning abroad have employee assistance programs, or what we call EAPs. I think Kathlyn's presentation spoke to that issue. But clearly there are, and of course the worldwide famous Alcoholics Anonymous program, which has expanded into many other 12-step programs, including helping people cease smoking behaviors as well. So the mechanisms are out there. The mechanisms are out there in the United States. They're beginning to be expanded into other countries, and they're efficacious. We simply need to have the courage to implement them all over the world.
And as Kathlyn indicated earlier, the educational model that goes along with that can address large populations all at once, and so that should be part of the health plan probably continuum.
Absolutely.
And we're going to go now to the Universidad de Sonora in Hermosillo. And your question, please.
Muy buenos días.
Muy buenos días.
Hablamos desde la Universidad de Sonora del
We're calling from
de la Universidad
Sonora University in Hermosillo, Sonora, Mexico. Greetings to Ms. Kathlyn and Dr. Lippin. Congratulations for these wonderful topics, and we find them extremely relevant, especially at these times that we are faced with in history and the turn of the millennium. Just one point of view that you have mentioned here I'd like to comment. We definitely think that health is one of the most important aspects, and we have to take care of that. And I think that education in this area, health education, has to be a commitment on the part of all the world's citizens in general, so that we are not all medical doctors perhaps, but people who are aware of health and illnesses that attack and that are insidiously affecting all the industrialized countries and societies and all the developed countries. And some of the developing countries are beginning to suffer from these things. This awareness, this should become part of the whole educational system. And I believe that we should attack the problem of health on all these levels, and this would be much less expensive than correcting the problems generated by the illnesses themselves. Of course, in order to do that, we would need politicians and leaders who are healthy, and also the participation of citizens and of all the organizations in our countries. And so this is basically my participation here. There's no question, it's just a comment. Thank you.
I think it's a great comment, and I would just, for a quick follow-up, ask Dr. Lippin, the preventive medicine model the caller just really described, how critical is that as we go into the new millennium?
Extremely important. And I would say almost that preventive medicine is education. It has a great deal to do with education. So when I think about preventive medicine, I think about education. So I think your question is very important and very relevant.
Very good. Thank you. Let's move now to the Universidad Autónoma de Chihuahua in Chihuahua, Mexico.
Buenos días.
Our question is related to the comment made by the Sonora University just a minute ago. Have you any idea of the curricula of the schools of medicine? Have they actually incorporated this concept of biopsychosocial concept in order to in order to make them aware, the future medical doctors to be aware of this?
Well, I guess we'll let Dr. Lippin answer this one.
Extremely important question. That's where it all begins in the medical education process. I would say no. Medical education in this country was designed in 1918, the so-called Flexner Report. And it hasn't changed significantly since that time, which is a great tragedy, actually. There are many organizations who are looking at changes in medical education, but the powers to be are very slow to change in that regard. One of the bright lights is the number of medical education curriculums that are now including alternative medicine. And I view that as a model for moving toward much more education on the humanistic aspects of medicine, the biopsychosocial model that we spoke about today. So I would urge any of you involved in your countries in medical education to try to influence this process. And I'm going to try to continue to do that in the United States as well.
Is the occupational medicine component of preventive medicine training in terms of the number of hours growing, or is it still 8 or 16 hours total?
I would say that it's an uphill battle, but prevention, by virtue of sheer economics, is a necessity. Yes. So George Lundberg, who edited the Journal of the American Medical Association, said unless we pay attention to prevention, we're looking at economic meltdown. Right. So some of the medical schools are beginning to improve their curriculums in preventive medicine, but it's very slow, and I think too slow. So we really need to shake things up a little bit in that regard.
Very good. Thank you, sir. Our next question comes to us from the Servicio Nacional de Aprendizaje in Porto Alegre.
What is the relationship between? ¿Puede repetir? What's the relationship between the employment and the satisfaction with your work? Gracias.
Okay.
Muchas gracias.
Thank you. Kathlyn, satisfaction between work and where you work, I suppose.
I think that certainly most of us think that it's related to your salary. In fact, most surveys show that salary is not necessarily the number one indicator of employee satisfaction. Important to the employee is challenge in the workplace, a feeling of being appreciated and valued. And I think one of the things we've been talking about throughout this entire program, and especially tying to Dr. Lippin's presentation, has to do with finding some level of enjoyment in the workplace. Certainly for many of us, we look at work as I've got to show up at the beginning of the day and go home at the end of the day to collect my paycheck. Well, many employers are looking at social activities where their employees can laugh together, can dance together, can enjoy the arts together, can learn to participate in their daily activities of the workday with their peers in a much more congenial environment.
Thank you very much. That's something we all need to spend some time on. We're going to go to the Universidad La Salle in Pachuca, Hidalgo.
Our question is, how can you detect, how can you determine that a person is actually going through a depression? How can you actually tell?
Signs of depression, Dr. Lippin.
Yeah, this is very well documented, and we need to educate physicians and we need to educate patients about the early signs of depression. But there's quite a bit of science behind the answer here, and I'll just name some of the early indicators. So impairment in mood, just feeling sad, inability to concentrate, early morning awakening, a loss of a sense of humor, changes in appetite, sometimes eating too little, losing one's appetite, or eating too much. These are some of the cardinal signs of depression. Certainly if someone stays in bed a lot more and there's reduced locomotion, that would be another one. But these are some of the cardinal signs of depression that we have to look for, and we have to have the courage to diagnose this disease. We've tended to underdiagnose depression. It's a very serious epidemic, and it's highly treatable.
Yes.
So this is a very important concept that we need to diagnose more depression, we need to aggressively treat it, and save more lives.
Highly treatable. It's critical to employers to maintain all the time and effort they've put into a worker's training and their productive capabilities, and have to overcome that. Let's move now to the Universidad de Occidente in Los Mochis, Sinaloa. Thank you very much for the call.
How can you take care of health problems of the public education sector in the United States? How are those needs met? The needs of the public schools teachers in the U.S.
I'm going to come back to Dr. Lippin on this one, but I guess there's two ways to look at it: the health of the teacher or the role the teacher plays in health education.
Yeah, I'm very concerned about the health of teachers in the United States, especially in inner-city public school systems. This gets more to the issue, in my opinion, of not only providing some stress management capabilities in the school systems for the teachers, but it gets to the issue of making some radical changes in education, in the enterprise of education in inner cities in the United States. We really need to improve the environmental quality in the broadest sense of the word for teachers. Because an unhealthy teacher who comes to work every day is certainly not a good teacher. And again, this would be preventive medicine at its finest, helping our teachers.
And if the environment in which they work is not healthy, mentally or physically, then they are not effective teachers as well, or as effective as they could be.
Absolutely.
Yes. Thank you very much. The Universidad Autónoma de Tijuana in Tecate, Baja California, brings us our next question.
Buenos días, soy Antonio Fuentes Madueña.
Antonio Fuentes, and I'm a student at this university. My question is, what can we implement on a medium to high level to try to implement programs to prevent drug use and drug abuse, and how can this be done, and how would this affect the overall quality of education?
Kathlyn, from one thing that you could do that you think to implement programs that affect drug abuse or substance abuse?
Begin early. In the United States, we've got very effective programs called DARE programs that are being introduced in the elementary schools, and there's some question about whether or not we're starting to introduce children at a very, very early age, in 3rd and 4th grade, as to the pitfalls of drug abuse. My response is you cannot introduce them early enough. Children are being approached to purchase drugs, to sell drugs at 8, 9, and 10 years old. So my response is the schools have to begin early, churches have to begin early, physicians have to begin early, having dialogue with their pediatric patients and with the parents of those patients.
One thing, Dr. Lippin, that you would recommend for substance abuse education?
Complete agreement with my colleague to my right.
Okay.
Complete agreement.
Begin early, start early. And
Early education is a key.
Don't come off the course. Very good. Antonio, that was a great question. Thank you very much. We're now taking our question from the Coca-Cola FEMSA in Buenos Aires, Argentina. Thank you very much.
Hola. Sí, buenas tardes.
I would like to know how you view or how you feel about the impact of the environmental conditions on the health of the employees, and do you think those conditions or models that you have for improvement are applicable in the developing countries?
Let's go to Dr. Lippin with this, because he has picked up some environmental duties in his job.
Yes, I have.
And do the models that we use in the U.S. work everywhere else?
I think so. You know, when we speak about the environment to which workers are exposed, there's the outdoor environment, so the quality of the air, the water, and the soil. And then there's the indoor environment. Indoor air is a very important issue in office buildings these days, as you know. And such things as lighting, the number of people in a given space, the population density issue, sound, odors, etc., etc. My specialty is taking a very strong interest in this topic, and we think clearly that some of the models that we've developed are valuable and they can be applied to other countries. We need to do a better job. We need to take the successes that we've had in the United States and apply them to other companies in the United States, and then by example throughout the world.
Very good. Thanks, Dr. Lippin. Let's move now to a question from the Centro Universitario de Tijuana.
Buenos días. Ante los intentos del gobierno mexicano.
The Mexican government has attempted to privatize the social security system following organizational schemes that are similar to the ones in the U.S. What measures do you think we should apply in order to prevent the problems that you in the United States are currently faced with, in order to standardize your own system, so that we don't copy the bad things in Mexico, so that they don't reproduce in Mexico? And also, how could we implement the model of the responsible pleasure in a culture that is so traditional as the Mexican culture? Have we gone too far?
Okay, kind of a two-phase question. Let's come to Kathlyn for the issue of avoiding problems that we may have experienced here quickly, and then we'll do the responsible pleasure side here.
Most importantly, I think that other governments that are looking at the United States model of entitlement to health care, they need to look at self-responsibility. I think that at any point someone is giving something for free, that they don't see the value of those programs. I think that all of your citizens should have to make some level of contribution, a small level albeit, but a level of contribution that allows them to feel ownership in the program in which they're participating.
I like that ownership. Empowerment, you both talked about that. Responsible pleasures.
Yes, you know your culture better than I do, but I have an intuitive belief that all cultures, and certainly especially Latin American cultures, have an enormous capacity for pleasure, for responsible pleasures. I think about the wonderful cultural traditions you have in your countries, the arts, dance, music, the natural beauty of your countries and the capacity for every citizen of your countries to engage in these very healthy, responsible pleasures. So I don't underestimate your country's capabilities of engaging in healthy, responsible pleasures and teaching us in the United States to do so.
Okay, good. Excellent responses. Thank you both. Let's move now to San Jose, Costa Rica for our next question.
It's hard to not say what you want to say.
There are certain cultural and religious aspects that are inhibiting the well-being, including the more work as punishment that increase stress. So those are some schools of thoughts. What do you have to say about that? How can we eliminate that?
I'd like to dedicate an entire new program to that topic. It's so important. I disagree with the notion that healthy religious practices and cultural practices are incompatible with health. I think actually they're synergistic. They can work together. But I think that deserves another program, a very important question.
Kathlyn, follow up on this?
Same response. I think that we need to spend a whole lot more time on addressing this kind of issue.
How could we do that? In the context of health plans, yes or no?
I think that in the context of health plans, we need to have a responsibility and understanding of the role that culture plays in the healthy lifestyles of our members, our patients.
Great. I want to thank you both very much. And excellent questions today. Thank you very much. But we have run out of time. And thank you again, Kathlyn and Dr. Lippin, for your excellent responses and participation in this video conference. We will continue transmitting programs on the latest in negotiation and dispute resolution and global competitiveness. And we invite you to participate in our final program for this year, which will air on December 9th and is entitled Quality and Value in the New Millennium, the True Challenge for Future Client Satisfaction. For additional information on the International Training Center's programs for this coming year, please consult your participant's manual where you will find the dates and specific topics for each program. Also, if you are interested in participating in training programs which will be offered by the International Training Center, please contact the Center by letter, phone, or fax. On behalf of all of us who collaborate with the International Training Center, I thank you for your participation and interest in today's program. Thank you, and we look forward to seeing you again soon.